Magandang gabi po sa inyong lahat. I hope it is Wednesday night when you will be watching this. Greetings from the States here in Illinois. And I want you to know that uh, Sir Flint, Pastor Flint, and I have been praying for you all there, those many people that were affected by the super typhoon, and the chaplains and pastors and churches who are ministering to those affected. And we just ask for God's strength and mercy and provision for those of you that are ministering, taking care of them, and those that have been affected in various ways. So just wanted you to know that. And also, I pray for those of you that are in your training journey. And I'm just super proud of you, very joyous about all that you're doing. And I'm grateful that I can be a small part of that. So, without any further ado, our topic tonight is on acceptance based behavioral therapy for generalized anxiety disorder. And the short way to say generalized anxiety disorder is GAD. GAD. But I will probably just pronounce the whole words because I don't want to get my letters mixed up. Um, as with the other sessions, the other modules that I have done, I I trust that you are beginning to see how all of these mental health disorders are interwoven or overlapping in some way to some degree. Because we've talked a lot in the last four modules, didactics, about different kinds of anxieties and panic attacks and different things that cause anxieties. And so tonight, I want to specifically let you know that general anxiety disorder has been called the basic anxiety disorder in the sense that, by definition, it is a component of other anxieties and related disorders. So it is chronic, um, and some of the other mental health disorders that we've talked about can be chronic, but they can also come and go. And general anxiety disorder is chronic, although there may be fluctuations that occur in times where the anxiety gets very, very high, and it's kind of like a bell curve. But it is a chronic situation, and some psychologists or mental health workers will say that it can also be a form of personality disorder, in that many individuals can't report a specific time or definitive age of onset. They have just always felt in their being, in their personality, they've always felt this anxiety disorder. So they didn't maybe know that it was called that, but there were symptoms that they experienced, and it's just always there. It's always been there. Um, Psychological and drug treatment, psychological psychotherapy, counseling, and drug treatments have not produced the results that some of the other disorders that we've talked about have good results with treatment. So this Acceptance-based behavioral therapy is a third wave of cognitive behavioral approach. So this is a newer model or approach, although it does use cognitive behavioral therapy in that. So you may have heard of the DSM, which is 5 now. This is the 5th edition. The D is diagnostic, S is and statistical manual of mental disorders. It is, I think, the latest revision, edition 5 was put out in 2013. But it is considered the authoritative guide for psychiatrists, psychologists, all mental health, as well as medical health care workers. And there are criteria that defined a mental illness or mental illness disorder. And so the GAD, general anxiety disorder, centrally defined in the DSM, where criteria are unchanged by excessive anxiety and worry more days than not over a period of at least 6 months. So that's the criteria, and all mental health disorder diseases are classified through research, timely research, and criteria is established to name each disorder. Clients who meet the criteria for generalized anxiety disorder also report difficulty controlling the worry they experience, as well as 3 or more associated symptoms. Most of the time, muscle tension, irritability, restlessness, or feeling keyed up, sometimes difficulty concentrating, or the mind just kind of going blank, being easily tired, and difficulty sleeping. But as you see, some of these symptoms are also symptoms of the other 4 modules that we have talked about. So as we go on, there'll be a little bit more specific information and clarity about how they know when it's the generalized anxiety disorder apart from something else. Let's see. Another thing to remember is that those clients, patients, counselees that have GAD, it makes them more higher risk for the development of other mental health disorders, particularly major depression. And so that's why a lot of the drugs, medicines are called anti-anxiety depression medication, because the part of the brain that causes the emotional system and the depression or the chemical imbalance, they're the same for anxiety. And then sometimes the more anxiety sets in and spirals down, the more depression, because of the way the person is feeling about themselves and the constant fear and threat. So just wanted to bring that out. And a few more facts. I don't know if it would be true there in the Philippines, but here in the States, when people have these kind of symptoms that I just named, muscle tension, irritability, restlessness, trouble sleeping, feeling uptight, keyed up, difficulty concentrating, and being easily tired, they often seek medical attention from the doctor, general practitioner, rather than thinking that it might be a mental disorder, a mental health disorder. And so, or wanting help with the anxiety, maybe meds for that. So in the States, they start usually with the medical doctor and then may or may not go on and seek mental health attention. Although these days, the mental health crisis is just more and more severe in the States. So maybe that is changing and people are seeking attention for that. Most of the cognitive behavioral treatments for general anxiety disorder emphasize trying to interrupt the cycle of obsessive worry and fears and anxiety that keeps climbing. So trying to think differently and then intervene or interrupt the cycle. But there are various techniques even in that. GAD is associated with both deficits in what we call emotional regulation, the ability to regulate or control our emotions. So the anxiety gets to the point that the worry is just the thoughts can't stop, and usually the things that a person is worrying about are miscellaneous topics or minor matters, but it's like the brain, the thinking will not stop. It's just pressing. And worry is been determined to actually be a cognitive habit. And with the criteria for general anxiety disorder, a lot of it is worrying without stopping and being stuck in the cycle of worry and threatening thoughts of thinking of the worst that can happen. So that is the reason why a lot of cognitive behavioral therapy is focused on interrupting the cycle. GAD is also associated with interpersonal problems, including increased marital distress. And once again, in your culture, in your country, I don't know if people are aware of it as much in a marriage, but it can cause stress on the marriage because it's affecting the other spouse. But a lot of other interpersonal relationships are affected by general anxiety disorder. And so, and if a person doesn't get help, then the general anxiety disorder becomes an intolerance of uncertainty about the next day or the next month or the next week, the uncertainty about the future, and then the responding to those thoughts which create feelings of uncertainty. It really can be debilitating, as we've said in the other disorders as well. So that is some of the description of the general anxiety disorder, and I thought that was important to talk about that first, to give you a summary before we talk about the acceptance-based behavioral therapy. And once again, it would be nice if we could be in person. and you could ask questions. But we are doing the next best thing. Let me make sure I've covered everything that I want to before I go on to the therapy techniques. This article that I have gotten this didactic out of indicates that the acceptance-based behavioral therapy targets the reactivity to the distress about internal experiences and experiential and behavioral avoidance. So we're going to learn that the way people with general anxiety usually adapt and try to protect themselves is to avoid anything that causes them anxiety, and to try to bury the internal emotional experience and not really deal with what is real. So this is what we're going to be talking about, and with that I'll go on to the more of the specifics about the acceptance. So it involves helping people, clients, accept their thoughts and feelings without judgment of themselves. And that's very important. And not only is there an acceptance, learning to accept, but also the resolve or commitment to work on their behaviors, which will align with their own personal values for life. And this will involve the following components. Number one is the acceptance of thoughts and feelings. Instead of trying to control or eliminate anxious thoughts and feelings, individuals learn to observe, name them, and accept them as natural, normal responses. So it's a whole paradigm change there, where instead of fighting or denying or struggling, there's this cognitive behavioral therapy technique that's going into more of the inner being of accepting and naming them, accepting them, and then realizing that a person can change their behavior, and it's normal for them. So the goal is to reduce the struggle against having these thoughts and feelings, which a person then realizes, oh, that if I struggle against the thoughts and feelings that I'm having, then it only causes the anxiety to rise higher. So acceptance, it requires self-awareness, of course, and a counselor or psychotherapist. As I've mentioned before, psychiatrists don't usually do a lot of counseling or therapy, but mostly manage the medicines. But anybody that can help that person learn to accept their thoughts and feelings, and then be committed to try to change those or manage those. The second one is diffusion. This involves distancing oneself from thoughts and recognizing them as mental events rather than absolute truths. So, in other words, the thoughts come in that produces anxiety, and instead of trying to distance the inner being from them, then the goal is to recognize them as, oh, this is my mental hiccup, if you will. This happens, and I recognize it, and I know that I can overcome it, and so this is what I'm going to do. So a diffusion of all of that tremendous amount of anxiety and threatening feeling of what's going to happen, what will I be able to handle it. And then, so acceptance of thoughts and feelings, diffusion, distancing oneself from the thoughts and recognizing them not as absolute truth, but as a mental event. So it's not so absorbing and overwhelming. The third thing is mindfulness, and we have talked a lot about mindfulness in the past. Mindfulness techniques are often used in cognitive therapy to help individuals become more aware of their present experiences. So bringing them back to the very present moment, and it takes them away from the total focus on the anxious thoughts. And this can help them detach from the cycle that starts going on and engage them more fully in the present moment. And that's why muscle relaxation is so helpful when a person is feeling anxious, because the thoughts are taken from the fear, the threat, to the body, where deep breathing and focus on one word like peace or love or forgiveness or whatever the one word is, but just being aware of the person's present state and their body, of what the body's doing in terms of relaxation. So that's why mindfulness has been very popular and gained a lot of momentum in mental health fields. And then 4, clarifying values. So acceptance-based therapy encourages individuals to identify their core values and what truly matters to them. And then this in turn provides motivation to engage in the actions that align with their values, despite anxious thoughts and feelings. So you're helping that client name their core values, what's most important to them, and then discover actions that will help them engage in those things that are important to them, and then learn to do that in the midst of some anxious thoughts or feelings. The 5th one is committed action. Individuals are encouraged to take action that are consistent with their values and life goals. So the commitment is kind of after the clarifying of a person's values, core values, what's the most important to them. For example, a core value would be needing to have good relationships, and being known and knowing others in a relationship, loving and being loved. That's kind of an existential core value. Now there's other moral values and other kinds of values, but it has to do with knowing what's important to that person and then living in that, rather than living in fear and anxiety. So the field of psychology is just always evolving, and it's really come a long way, and research is trying to try out new therapeutic approaches. They do a lot of experiments and research trying to know criterias and know how a certain therapy is effective. And so it's constantly changing. And I want to say the last thing I want to talk about is um, that just to go over again the acceptance based behavioral therapy, there are two main factors, and that is in the psychotherapy, that is reactivity to internal experiences. So people with anxiety disorders tend to react to their own thoughts, feelings, and physical sensations in a way that makes their anxiety worse. So they're truly reacting, and it's not reacting off of a perception of what other people are thinking, but rather they are reacting and judging their own internal experiences. And then in turn, they may suppress or control, try to tightly control their thoughts, avoid situations that make them feel less anxious, even if it's something important to them, or engage in negative self talk. This is a strong possibility characteristic of generalized anxiety disorder. So when a person starts to feel bad about themselves and their anxiety, they'll have a lot of negative self-talk. And then the second factor is with this kind of therapy is experiential avoidance. So people with these anxiety disorders also tend to avoid activities that they enjoy because they're afraid of the sensations of feeling anxious. And like I've said before, this creates a cycle, a downward cycle of anxiety avoidance. So they don't really get to fulfill the things that are important to them as much. So again, we are teaching them to accept their internal experiences instead of trying to control or fight it or avoid, but trying to accept. And then they practice that. It doesn't come easy. So with the accountability of someone that's supporting them in that, or a counselor, then they can try to keep practicing and can report on how it's going. And then, as I've already said, to encourage the clients, the counselees, to engage in things that are important to them. And as they do that, they build confidence and they experience the positive benefits of things that they enjoy. And with time, there is a change in attitude, behavior about themselves, and they feel more confidence and more empowerment to try to manage and handle that. So, and it's interesting because if a person here in America goes into a mental health clinician, then and they meet the criteria in the DSM manual for general anxiety disorder, then it's almost been established that there would be 12, a minimum of 12 sessions. Now that may seem like a lot, but what is happening is the consistent accountability and talking and having the counselor listen and report and accountability and encouragement. So it takes that many sessions to try to break the cycle or change it. And I think there is a 65% rate of efficacy with this technique of trying to help people with generalized anxiety disorder. I mean, I meant to say that even with all the other meds, just plain cognitive behavioral therapy and this acceptance based behavioral therapy, there still seems to be, with generalized anxiety disorder, kind of maybe component of a personality disorder. It's chronic, and to completely get over it, there seems to be um, a lower success rate. But it doesn't mean that a person cannot be helped or encouraged to keep on and generally find themselves able to see it for what it is, accept it, and learn these skills to help manage it. So, okay, that is this didactic, and I pray that God will continue to give you the motivation to learn, and as you minister, God gives you the strength to do everything you need to do. You're learning a lot. So, God bless you. Goodbye.